Welcome to another episode of Quick Medical Review, where we unpack essential medical topics in under 5 minutes. Today's topic is rheumatoid arthritis, a classic autoimmune disorder. Rheumatoid arthritis is a chronic systemic inflammatory disease that primarily targets the synovial joints. It is characterized by symmetrical, multiple joint involvement, especially affecting the small joints of the hands and feet. The peak incidence occurs in middle-aged women, with a strong association to the human leukocyte antigen DR4 gene. Pathophysiologically, rheumatoid arthritis involves immune-mediated inflammation of the synovial lining, which leads to pannus formation, cartilage destruction, and eventual joint deformity. Pro-inflammatory cytokines such as tumor necrosis factor alpha and interleukin 6 play a central role in its progression. Clinically, patients present with morning stiffness lasting more than 30 minutes, joint swelling, pain, and systemic symptoms such as fatigue and low-grade fever. Classic deformities include the swan neck and boutonniere deformities. On examination, look for tenderness in the metacarpophalangeal and proximal interphalangeal joints, along with reduced grip strength. Rheumatoid nodules and extra-articular manifestations such as pericarditis, pleuritis, and scleritis may also be observed. Diagnosis is based on clinical criteria supported by laboratory findings, positive rheumatoid factor, and anticyclic citrullineated peptide antibodies. Elevated erythrocyte sedimentation rate and C-reactive protein levels reflect ongoing inflammation. Imaging typically reveals periarticular bone loss and joint space narrowing. Management begins with nonsteroidal anti-inflammatory drugs for symptom relief, but the cornerstone of treatment involves disease-modifying antirheumatic drugs, particularly methotrexate. Biologic agents such as tumor necrosis factor inhibitors are considered in resistant cases. Corticosteroids may be used for short-term control of acute flare-ups. Complications include progressive joint destruction, instability of the first and second cervical vertebrae, and systemic vasculitis. The prognosis is variable, but early and aggressive treatment significantly improves outcomes. To sum up, rheumatoid arthritis is a progressive autoimmune joint disease with widespread systemic effects. It is diagnosed through clinical evaluation and supported by serological and radiological findings. Effective treatment with disease-modifying medications can prevent permanent joint damage and improve quality of life. That's it for today's quick medical review. If you found this helpful, share it with a colleague and subscribe for more clinical gems every week. Until next time, stay sharp, keep learning.